literally trick your brain, trick it to do anything you want it to do, anything you want it to think of. Use your brain as a tool. Don't let it control you.
What's up, guys? Welcome to the Physio Diaries podcast. We are your co-hosts, Dr. Melanie Ziaziaris
and Dr. Alice Koshevatsky, where students, healthcare professionals, and wellness junkies come to get the inside scoop of the healthcare and wellness industry.
The podcast you didn't know you needed by your favorite travel physical therapist.
Hello, what is up, physio friends? Welcome back to episode 28. Today, we wanted to talk about a hot topic in the wellness space and in the physical therapy field as well, and just the medical field in general, pain neuroscience. It's a very hot topic and kind of like a buzzword. So you might be wondering kind of what this is, and we will tell you exactly that today. A lot of programs are incorporating this into their curriculum. We know ours did in our physical therapy program. And we find this stuff super interesting and really important to talk about no matter what profession you're in the medical field. So let's talk about it. Tell us, for those that are either pre-health students or just anyone that's listening that is interested in health, what is pain neuroscience?
Yes. So to give a very generalized explanation, it's pretty much how our nervous system processes and perceives pain. So the biggest I think takeaway is that pain is our emotional process of what we're experiencing. A lot of things are involved with pain. It's not just as simple as like you get a cut, you're in pain. It's like way more complex than that. And the signaling that happens throughout our nervous system and processing our brain, how we experience emotions related to that, it all contributes to that pain neuroscience and like pain response we have.
Basically the science behind pain, and really more so chronic pain, because we see a lot of people that are hypersensitive in our profession. I'm sure other professions as well that are very hypersensitive to really anything. And I guess the degree of pain that they experience does not correlate with the amount of tissue damage that was done. A lot of people have started doing more research about this and for figuring out why it happens and how to address it, which I think is super interesting.
Yeah.
So,
And just like pain in general too, like we wanted to talk about this because for one, like we don't really talk about pain, you know? We don't talk about the different types of pain. We don't talk about what sensations we're feeling. We just know pain is pain, and that's our body's response to things, and that's it. And then we go about our day. So we really just wanted to get deeper into the topic of pain because it is way more complex than you may think.
Yeah. Our profession,
especially if you're not in healthcare.
Yes, our profession especially centers around pain. Sometimes when I have somebody come in and they don't have any pain anywhere, sometimes I'm like, oh my gosh, what do I do? Then I remember that there's still other impairments that you can have and different things. But most of the time we are treating pain or post-op with pain. Like pain is everywhere in our profession.
Yeah.
So a little bit more about the nervous system, because that is kind of how those pain signals come to the brain, and that's how it perceives it. So there are trillions and trillions of nerves within our human body. So nerves are basically like the highway system. The nerve connects like your muscle or your skin or any kind of tissue to the brain. So they send signals back and forth to each other via the nerves or the nervous system. There's about 45 miles of nerves throughout our body. So that is a lot of nerves. They're all connected, like we said, and they're almost like our alarm system designed to keep us alive, really, and to send danger messages when there is a perceived threat, such as if you step on a nail. Okay, ow, that's going to hurt, and you're going to draw your foot away, right?
Yeah. Nerves do like literally all types of signaling that you can think of. We're just gonna, like there's way more to nerves, but we're talking about it more in terms of pain.
What happens is a quarter of people actually, when they have some sort of tissue damage, like a surgery or a really bad injury, like a crush injury of their foot or ankle, something like that, their alarm signal or that system, a quarter of the people does not go off. So that means that your nervous system stays super, super sensitive. It's extra sensitive, and the pain can last beyond the normal time frame of healing for that injury. We see this a lot, at least for me, ankle injuries, ankle surgeries, when people are non-weight bearing for a really long time. I think that this sort of almost rewires the brain to
Yeah.
think that even putting weight through their leg is going to be the worst thing and the most painful thing when it's disuse.
Right.
So I think that that's what I see it with the most. What do you think?
Do you mean just in terms of like not using that area?
Yeah, like when do you see, I guess, this type of pain where it's like abnormal to the amount of tissue damage that occurred, I guess.
Well, if we want to get into that pelvic floor, my
Oh,
goodness.
mhm.
That's like a whole other,
Ball
yeah,
game.
ball game
Yes.
for
When they
sure.
have like a really sensitive system and even like light touch
Yeah.
is painful,
Yes,
right?
yes, especially for the pelvic floor. Like most of the
Yes.
time, unless you had a vaginal delivery, there's not usually actual tissue damage. But, if I'm doing an internal exam and this person is here for pain with sex and they immediately feel pain, even with light touch.
Without a painful stimulus.
Yeah, yeah. And
Mhm.
like just the pressure, like of even
Mhm.
going into that area. Um,
Or the C-section scar can be really sensitive
Yeah,
too,
for
right?
sure, for sure. Yeah,
Yeah, that's a good one.
yeah. But
Mhm.
yeah, no, that's fair. Ankles and like weight bearing stuff is definitely a big one. Like trying to think.
Shoulder injuries. When someone has
Yeah.
been immobilized for a long time in a
Oh, with the
sling.
shoulder. Oh my god, the
Oh
sling.
my
I was just gonna say
goodness.
the fucking slings. Oh my god, I told myself I wasn't
Yes.
gonna swear and I swore. Anyway,
Oh, you did it first this time.
I did it
Not
first.
me, so I feel good now.
Oh my
Now
gosh.
we're good, now I can swear.
Yes, yes, the
But
slings.
I think I told you about the patient that I had that was in a sling for, like, over 6 months, and
Yeah, that's
we
wild.
started with the lightest, gentlest strokes because she couldn't tolerate anything. Now she's
Right.
getting a lot more motion, but it's still a lot of it is educating her about the pain and how
Yeah,
barely moving her arm is not gonna worsen her injury, and it
yeah,
takes a lot of education, which we'll talk about
yeah.
in the
I
rest of
mean,
this episode.
right, like, there's so much psychosocial involved with pain as well, so, like, if you're
Yeah.
stressed, if you're kind of a more type A, kind of more high-strung person, like, your body's gonna
Yes.
perceive pain much differently than
Yes.
even a type B chill person.
That's funny
Um,
that you say that
yeah,
actually, because I'll just mention this now because you talked about stress. So,
yes,
more recent research talked about how, like, you can have an extra sensitive alarm system
yes,
if it's cold outside,
yeah, oh,
which
yeah,
can be a
yeah,
big one because that
mhm.
kind of
Oh,
stimulates you to tense up.
right, right, going off of that, everyone
Mhm.
that comes in and says, "Oh, it's the weather, it's making me hurt."
It can be. Yeah,
Can
it really
because of that,
can.
like, the
Because
cold is
usually I'm like,
increasing your
"Okay."
sensitivity.
Yeah, but
Yeah.
then usually when they say that, you kinda question them a little, like, "Is
Yeah.
it?" But it really can be. Yeah, if it's cold outside, if you are
Mhm.
stressed, if you move a body part or press against a body part, that can make it more sensitive. If you have the flu, actually, and we'll
Oh,
get
right, like
into that a little
immune
bit more.
system. Yeah, that
Yes,
makes
because your
sense.
immune system is heightened and you
Mhm.
have more of those inflammatory markers that can increase your alarm system and make you extra sensitive. Like, do you
Yeah.
know when you are sick and you feel body aches everywhere?
Yes, like,
Like,
everything
you
just
just
hurts.
hurt. So
Yeah.
imagine because you're extra stressed, your body is at this heightened awareness, your immune system is going off too because you have a lot of swelling in the area that's extra
Mhm.
sensitive. So that leads to an extra sensitive
Yeah.
body too. And then
Yeah,
sometimes if you sit too long, so that's wild. So just
for
being
sure.
more sedentary, you can predispose you to this chronic pain and
Yes.
hyper awareness of pain.
Totally. And it's like, it's so tricky too, because if you do have chronic pain, you're going to think that you need to sit and rest or you can't do this, but that's actually making it worse,
Worse.
and can really
Hmm.
heighten that pain response because you're actually not using and moving that area. So everything kind of cycles off each other. And this is what a lot of people don't know or understand. And,
Hmm.
like, it's not anyone's fault that they don't understand it. It's just because we don't talk about it enough. So, no, we are.
Yes. Yes.
So there's three different types of pain. So there's nociceptive, which is like that area is truly injured. There's neuropathic, so nerve pain. Classic example, sciatic pain, I feel like most people know that one.
Hmm.
And then nociplastic is when there's not actually any damage to that area, but it creates a response because of the increased sensitivity of your nervous
Hmm.
system and the area around it, and then that creates pain. Um,
So this would
So
be plastic, right?
yes,
Yeah.
nociplastic. Yes. So I feel like a good example of that is like low back pain without anything showing on imaging, right? Like your x-rays clean, your MRI is clean, no disc bulge, herniation, no nothing,
Mhm.
but you have pain.
Or, like, would phantom limb pain be one? Or
Ugh.
is that
That's
I
I
was
think more
wondering because
neuropathic, wouldn't it?
neuropathic, but
I
the
guess
nerves are not
that
there
crosses
anymore.
over. Yeah,
Yes.
but then they're
Yeah.
cut, so then it's
Mhm.
like
Yeah.
I
'Cause it's
feel like
not
that's a
actual
crossover.
pain.
Yeah,
Right. I
that's
remember
a
them
cross.
talking about it.
Yeah, you're fair.
That's a
I
hard one.
honestly those were hard in for me in school.
So for those of you that are currently in school, can you give us a refresher or comment which type of pain is phantom
Let me
limb
look it up.
pain? Is it nociplastic or nociceptive? Because these always messed with my brain. Yeah, please
Yes,
look it up. I'm curious.
I know, me too. I'm like, "Wait, neuropathic."
Okay, so it is
I
still
was right.
neuropathic.
Yes, because
Yeah.
technically it's like the nerves are just so confused on what to do and where to go because there's no
Yes.
end source anymore.
Yes.
Like, what was it? That motor end plate. So then
Yeah.
they're like, don't know what to do. And
Yeah.
they're
Okay,
just
so
like scrambling.
nociceptive. No,
No,
wait,
neuropathic.
neuropathic.
Neuropathic. Nerve,
Oh my
nerve,
god,
nerve.
it's too late for this.
It
I
is
didn't
really
get this in
late.
school. You know what? Anyways, we hope that you guys learn this in school and get it down after this episode.
Yes. So phantom limb pain, neuropathic.
Neuropathic. What was actually really interesting and what I use, and I don't remember the guy's name, but we will link maybe his website because he sounds amazing and I would love to have him on the podcast. It might have been Aaron something, but he
Okay.
created these cards. He's a physical therapist and I think he has his PhD as well. He created
Oh.
these cards and it's a deck of cards, why you hurt, maybe something like that. We'll link it. But they are amazing. They're an amazing resource to use with your patients. One of the cards actually had a really great image. There was 3 rows of brain scans. The brain scans are for people that have ongoing chronic pain.
Mhm.
And they had just kind of been given various explanations of their chronic pain and they were confused and not really understanding what was going on with them. The first row basically on top is the patient relaxing in the scanner and the brain is calm. There's no activity. Nothing's going on because they're not moving. The second row, the patient starts to move their painful body part. So let's say it was their shoulder, like we just
Okay.
talked about.
Mhm.
Let's say it was their shoulder. And all these different red markers go off in the brain. They used to think that only one part of the brain processed pain, but it's actually so many different parts. It's
Mhm.
emotional, it's sensory, it's
Mhm.
memories of previous
Mhm. Right,
movements like that.
experiences.
Yeah, so it's a lot of different things coming on. So it's red, bright red when they move that body part because it's painful, and they have that nociplastic
Mhm.
pain. So,
Mhm.
it's rewired a little bit and it's extra painful. I love these cards. And the last row basically shows the same person after they had pain neuroscience education and
Mm.
someone thoroughly explained to them how the pain works and they actually ended up doing the same motion and less red blobs turn on in the brain. So that means that
Mm.
after their pain neuroscience education, their brain perceived less pain because they understood the science and the reason
Yeah,
behind why they were having the symptoms that they're having. And
yeah,
that was really cool. And that's a really good visual to show your patients when you're explaining this. And because sometimes if a patient will just listen to you talk about pain neuroscience and be like, this is some bullshit, this hurts, I'm not believing what you're saying and I
yeah,
totally wouldn't either. I don't blame them. But when you have those pictures, I think that really helps.
yeah, that's fair. Do you know
Mhm.
what, with the pain neuroscience they, like, emphasized or, like,
Well,
discussed?
I can tell you.
Okay.
So, let me take a look. So, basically they explain that have you ever had a bruise
Mhm.
where you look at it, you're like, "When did I get that? I don't even
Yeah,
remember how
and
that
you don't
happened."
feel it. Yeah, you
You
just see
didn't
it.
feel it. You
Yeah.
just see it, it pops up, but clearly there was tissue damage,
Right.
but no pain response,
Yes.
right? So in the
Yes.
same way that you can have tissue damage and then no pain response, you could have a pain response with no tissue
No tissue
damage.
damage, yes.
You basically just educate the patient a lot about different things. You can tell them different statistics, you can show them those graphs. It's just more about the science behind it. They talk about, perceived threats in the brain and how the brain is extra sensitive and the body is extra sensitive to these threats
Yeah.
because your nervous system is so heightened. It really breaks it down, honestly, very simple because
Yeah.
as we know, that is another art in healthcare is just breaking things down for patients to understand, not in our words and not in
Yeah,
our
for sure.
terms. And this stuff can get very
Yeah.
complicated. Yeah, they say that you really need to emphasize like happy thoughts and calm thoughts because these are the patients that you see that are super anxious to move,
Yeah.
super
Just say,
cautious to do anything.
well, then you get into like fear avoidance, pain
Mhm.
catastrophizing, literally just thinking about the pain. Like, honestly, some patients, if you think about the pain, you're going to experience more pain. Like, that
Mhm.
is just straight psychology right there. If you're
Yes.
ruminating on something and you're really just zoning in, that's all your body and brain is going to respond to and think about.
Yes.
So, of course, you're going to feel the pain,
Yep.
even like more. So many people also don't even understand different sensations in their body. And for people
Mhm.
who are not active, and for those that are listening and you work out regularly, you exercise regularly, you move your body a lot, and you can tell the difference between a pull, a stretch, a
An
muscle work, a
exercise
jab,
soreness.
right? Like there's right those different sensations we feel. There are so many people that you would never realize that don't know the differences because they don't exercise their body and they don't move. So then any sensation, their brain is now processing all of those sensation as pain.
Yes.
So I've realized it a lot in certain populations, especially those who don't exercise at all, like a
More
pull, a
sedentary.
muscle work, it all meshes into pain for them.
They're like, "That
So
hurts." I'm like,
yeah.
"Okay, keep
I'm like,
going."
"No." I literally tell them like, "No. Tell me the sensation. Is it a pull?
Mhm.
Is it a jab? Is it a muscle work or like a burn?" And
Mhm.
then they can understand and tell me, and then they're like, "Oh, it's a pull." And I'm like, "Okay,
Mhm.
that's fine. That's good. We want that." But if it's
Yes.
like a jab, we don't, do typically
Yeah.
don't want that. So,
Yeah. I was
it
gonna say too, like I've had so many different patients tell me, okay, this exercise is too hard. And I'll say, okay, back off a little. Let's do it gently. And then what I do is I start to talk to them about something that they like or something that I know they like to talk about, like their
yeah, that's a
grandkids
good
or
idea.
their hobbies. And you will
Right.
see when they're not so hyper focused on that body part, they start to do that movement so easily. And I do
Yeah.
that trick all the time. It's
Yeah,
diverting
that's
their
really
attention
good.
away from the painful body part, and that always helps.
Yeah.
But if someone's really, really bad and they can't do any exercise, they can't do any movement, something that the cards actually said to do was to have the patient actually close their eyes and visualize themselves doing that movement.
Visualization. Yeah.
Visualization is huge because all of this is coming from the brain. So if you can visualize yourself moving, a lot of athletes use this before a competition, like gymnasts. If they're going to do a big trick on
Yeah.
the vault or something,
Totally,
they
visualization.
visualize themselves doing it, and
Yeah.
then it's like visual practice, and they actually are able to do it well. So visualization is
Yeah.
huge,
That's a
especially
good
even with
one. I
chronic
forget
pain.
about that. Yeah.
Yes. And another example of a good exercise that I like too, that they said should help, is let's say you have a painful ankle or a painful foot. You will go through a magazine. Let's say it's your right foot. Okay. You have to like specifically choose the right or the left. So you're looking through the magazine, and they said just circling that body part and kind of bringing awareness to their body part in the magazine actually helps you as well.
Interesting.
Because with chronic pain, you actually have a different perception of that body part.
Yeah.
And so
Mhm.
even just doing simple things like going through the magazine or closing your eyes and
Mhm.
visualizing yourself doing it is huge for people
Yeah.
that are so just heightened and are so aware of
Yeah.
that body part
No,
moving.
totally. That makes a
Yeah.
lot of sense. I mean, there's so much that goes into it. Like we said, there's so much just like psychology and involved too,
Mhm.
because, pain is just what we perceive. Not everyone perceives the same amount of pain, the same level of pain, the same
Mhm.
sensations. So it's very
Mhm.
individualized at the end of the day.
Yes. And I hate because, there are some insurances or some clinics that will require you to ask
To
about
rate,
pain
I don't.
rating.
I
I
don't.
don't do it unless we have to, but
Have you
and I
had
don't even,
clinics say that you have to?
some insurances require you to.
What
Yeah.
insurances? I've never had that.
I don't know, but you need to ask about pain and see it, like, the level go down. Yeah.
Oh,
Sometimes
I guess we use outcome measures for that. So I usually
yes.
don't specifically ask them to write a number down because we have questionnaires for
Mhm.
that.
They
But
yeah,
that
they
makes sense.
probably have questionnaires, but I might be I don't know, Medicare, but I'm not sure, but there's definitely insurances that ask for that, or clinics that require you if they have, like, a documentation checklist, they will have you do that. But I don't even like to use the word pain sometimes because I
Yeah.
feel like it's associated with, like, a heightened
Yeah.
body state, even
Yeah.
when you say pain, and then you're attracting their attention to that area. So
Yeah.
instead, I try to focus on function. Not do you have less pain? I don't care as much as are you able to do more things? Because if you're able to do more things, you do probably have less pain
Yeah. For
because
sure.
you're tolerating more. And so we as a profession really focus on function and returning that patient to everything that they aren't able to do rather than like, okay, if you have less pain, great, but have you returned to, woodworking or playing with your little kids or whatever floats your boat?
Yeah. Yeah.
If we've reduced your pain, but you're still weak and you're still not functional, then I have not done my job.
That's fair.
So that's
But
how I
no,
feel.
that totally. And I was gonna say that goes back to our arthritis discussion. Many, many episodes ago, we talked about arthritis. There's two parts, but
Because
we
one
talked a
just
lot.
wasn't enough.
It really wasn't. It really wasn't. But that goes back to these like medical diagnoses too that people are internalizing, like the bone on bone, medical doctors saying, oh, it's bone on bone. Of course you have pain. But it's like
Right.
just because you have bone on bone, it might be more bone on bone, but that doesn't necessarily mean you can't move it and use it in exercise. So
Yes.
there's that whole aspect of like the healthcare
Mhm.
system too that is
Mhm.
making people feel like they're just a diagnosis and can't be like a person
Or
that just
they're
has
just
that.
their imaging.
Yeah.
Yeah. Okay, first of all, imaging does not correlate with the patient experience. There were a lot of statistics. These were actually really interesting, and I wanted to just share some of them and like talk about
Yeah.
some of them. So, okay,
Share.
first two, because a lot of like chronic pain happens with like lumbar discectomy. So like,
Like back pain and back
either
surgeries.
yeah, fixing part of the disc or anything like that, lots of back
Yeah.
surgeries. So 80% of NFL players who underwent a lumbar discectomy returned to playing in the NFL. So that means they're playing at a high level
Mhm.
and you basically explain to your patient that you are not in the NFL. You can do normal things. If this patient or this person that had the lumbar discectomy surgery, the same surgery as you, went back to playing in the NFL, you can go back to your daily activities.
Yeah. And for anyone
Right?
who's listening, like this is
Mhm.
applicable for your friends, your family,
Yeah.
your parents, your grandparents. Like that
Right.
surgery doesn't
Everyone.
mean that you can't move.
Yeah, exactly. And it was the same. It was in the 80s with NBA players
Okay.
as
Oh,
well.
wow. Yeah,
After the
that's
same
not good.
surgery. Yeah.
Yeah.
So studies have shown that a vast majority of patients after having a surgery like this do not need to limit or restrict their activities and movements later on once they're rehabbed.
Yeah.
So that is a big misconception. It's like, I can't do anything. I had back
Right.
surgery.
And yeah, I mean, I feel like everything we talk about just goes back to like the healthcare system. I don't know about you, but I've literally had people come in that said after a cervical like fusion or cervical surgery or even lumbar,
Hmm.
any surgery to the spine. Oh, my doctor said I can't pick up anything more than 5 pounds or 10 pounds. And I'm like,
But that's not forever.
no,
Yeah.
not forever. And
Yeah.
also, that's not functional. Like,
Yeah.
we're picking things up that are more than 10 pounds sometimes, especially
Yeah.
if you do gardening and household like things. And
Yeah.
like,
But
there's,
usually it's only for like several weeks, right? Not like
I've
forever.
literally had patients that think that it is for the rest of their life.
No.
Yeah.
Yeah.
Yeah. And I'm like, sorry, no,
No.
not
No.
right. But
But
we
they
are going to do
probably
some
never
things.
saw that. Yeah, we're going to have to lift a gallon of milk is almost 10 pounds.
Yeah.
So, yeah,
Yeah.
five
Literally.
is like nothing.
Yeah.
So, this is crazy to me, actually. 1/3 of people over the age of 30, which I'm close,
Yes.
have
Me too.
abnormal findings on their MRI rotator cuff
Oh my God, of
or for their
course.
shoulder, which makes
Yeah.
sense. Of
They make
course.
everyone, like, has something, like, I
Yes.
feel like.
Exactly, and then 66% of the people over age 70 have
Yeah,
rotator
of
cuff
course.
pathology, some kind of minor tear. If you
Yeah,
lift, if you
100%.
breathe, if you are existing, you probably have some rotator cuff pathology. It doesn't mean you should have shoulder pain. It's just how it is. It's wear and
Yeah.
tear, I guess,
Yeah, I mean, yeah,
So,
certain things are truly just aging, but
mhm,
I think what a lot of people don't understand is that
mhm.
they just assume the diagnosis is the cause of their problems.
Yeah.
And then that goes into that mental psychology, that fear avoidance, that like not wanting to use that area. And oh, I get a little shoulder pain. So like I get a little
Yeah.
something. So I can't do this. And so then they
Mhm.
become fear avoidant. That area isn't going to be used as much. You're going to get that increased sensitivity. And it all
Mhm.
just cycles over each other.
Yeah. That's why I think that in certain cases, imaging is overused. It actually can be sometimes more harmful than good for certain people that
Yeah,
are
that's
very
fair.
anxious, that might be like
Yeah.
hypochondriacs, because when
Yeah,
they see
totally.
moderate to severe arthritis,
Yeah.
that in their
Degenerative disc
brain,
disease.
degenerative, okay, yeah, so basically you're a human and you're breathing, right? Like,
And you're
of course,
aging and getting
and you're
older.
aging. Yeah. And so then, and I hate when people say, I have bone on bone. Okay. So,
I
and
literally
I
say,
think that,
"Okay."
yeah, I'm like, "Oh, okay, who told you that?" And so then, it really diverts their attention to that area and they're hyper focused on it. And I
Yeah.
think that, like you said, that can predispose them to having this chronic pain.
Mm.
Those are crazy statistics to me,
Those
though.
are crazy statistics. That's
Yeah.
good to know.
Okay,
There's
wait,
so
I
many.
have,
I mean, there's so many statistics out there. We could like
yes.
anything we say, there could be something like a research article to prove it too, you know?
Exactly, yeah,
Like
and
there's
like
always.
we said, there's a lot of research in this field. But okay, the last one that I did wanna say, because this is
Okay.
really interesting to me, I don't
You've
know if
been
you knew
liking the
this stuff.
statistics today.
I love them because I think that statistics also help patients
And just like people
realize
too, like
people
understand. Yeah.
understand kind of the background of all of this.
Yeah, that's fair.
Okay, so you know how people have bulging discs, right? Like, who
Yes.
doesn't? Honestly,
Right.
I'm sure I do.
I'm sure.
So
With all of the back bends I do and random things and
yeah, like
sports,
the
I'm
poor
sure.
lifting mechanics that I probably had when I was in my teens and poor muscle tone. I probably have a disc that's herniated or slipped or, it's in there.
A little.
So a person that had a bulging disc and they did nothing about it, they
Yeah.
scanned again 2 months later, and the disc is typically 20% smaller or less bulging than it
Yeah.
was before.
Yeah.
And sometimes after 9 months, it's completely gone. So it can
Mhm.
kind of
Yep.
spontaneously go back into place.
Yeah.
So our discs, for anyone that's wondering, because everyone's probably like, I have a slip disc, or what is a
Yeah.
slip disc? And nobody knows
Right.
what that is. But
Mhm.
basically, we have these like jelly-like discs in between every single section of our vertebrae. Sometimes with certain forces, some of the discs can slip, usually back
Yeah.
words, and kind of bulge out a little bit. So
Yeah.
they're out of place, I guess. They're like not where
Right.
they're supposed
And
to be.
when we say slip, it's not like literally the whole thing is
Like
slipping out.
falling
It's
out.
literally
Yeah.
just like a portion that kind of like
Yes.
protrudes in one direction. Yeah.
Yes, exactly. The discs work like a sponge. And actually, so when we're laying down in bed, they
Mhm.
are 20% more swollen because the water goes back into the discs when you're non weight bearing because you're
Mhm.
laying down. When we
Yeah.
stand up, gravity pushes down on them and the water kind of comes out. Depending on the time of day for your scan, for your MRI, if it's more in the morning, the disc is going to be more bulged because there's more fluid in there. So that was actually
Oh,
interesting.
I never thought about that.
Mhm.
That is really
So,
interesting.
yeah, and then they were also saying that scans
Yeah.
are usually done laying down
Yeah, for sure.
when you're not weight bearing, obviously because 'cause you're
Yeah.
in the MRI machine,
Yeah.
and so gravity can also increase the bulge.
If you're laying on your back, because then it's going anterior to posterior downward, so that
Exactly.
makes more sense. But
Yeah,
I've
or
yeah,
when you're
never thought about that
standing,
before.
yeah, when you're standing and weight bearing, it's gonna look more it's gonna be more
Yeah,
bulged than when you're laying down and
yeah,
gravity's not coming into play. So,
yeah,
like we said, imaging, that's just to say that imaging does not necessarily correlate with what you're experiencing and what you need to work on.
yeah.
And that's why we always kind of say that don't
Yeah.
focus too much on those results. I hate
Yeah.
when people come in and they just tell me, I'm just doing the 6 visits of PT because I want to get my MRI. And I'm like, and then what?
Going
Yeah.
back to the pain science, obviously
Mm-hmm.
we're talking a lot about most common things like back pain, shoulder pain, whatever. But this is very much applicable to other things as well. Like I talked about pelvic floor
Right.
pain and dysfunction. This is huge with that, especially concussions, dizziness, even that can be heightened due to all of these things we've talked about. This can really be generalized to pretty much anything you can think about outside of just your typical, surgical pain and like back pain and stuff like that.
Yes.
Yeah.
Agreed.
We just want to reel it back in and kind of go over the main takeaways for today's episode because it is late. We are getting tired, and this is going to be a shorter and efficient episode.
Yes, for sure.
So, main takeaways, there's different types of pain that we talked about, like that nociceptive, nociplastic, and neuropathic. When you do have pain or feel any sensations in your body, we really just want you to think about it more just in terms of like what you're actually feeling. Like if it's when you're exercising, is it a pull? Is it a muscle work? Is it a burn? Is it tingly? Is it actually a sharp jab in that moment, right? Like there's so many ways to further reflect on our body sensation as well. Like you would not believe how many people don't do this. So, biggest thing is stop worrying about that injured part. Obviously, there's always those it depends scenarios, but for the most part, like for chronic pain, you want to do as much as you can without fully limiting yourself. Like that fear avoidance, pain catastrophizing really heightens all of those sensations and feelings even more. So, any type of distraction techniques, we've talked about it before, but stimulating your parasympathetic nervous system. You can use breath work. In the future, we will have a way more detailed episode on that, but you can look up stuff on your own if that resonated with you. Think happy thoughts, redirect your brain and mindset is the biggest thing. Our mindset is so powerful and we
Yes.
don't use it enough. When you practice gratitude or like something like happy thought, feel good thoughts, it actually distracts and prevents the brain from having like anxiety, which is just that heightened nervous system response. So literally trick your brain, trick it to do
Mm-hmm.
anything you want it to do, anything you want it to think of. Use your brain as a tool. Don't let it control you. Control it.
Yes.
Um, Exercise is key. We cannot say this enough, not even just because we're physical therapists. We actually release endorphins and our body's natural opioids in our brain when we exercise. I think a classic example of this that a lot of like PTs and probably OTs for like the upper extremity bike do is
Mm-hmm.
like put people on the bike first,
Yeah.
which it seems like we're being lazy sometimes when we do that, but that is automatically getting that endorphin rush, more blood flow to your brain and that body part
Right.
that's in pain. Like there's so much more complexities to it, which biggest thing is more blood flow, better for healing that area, getting that endorphin release, getting those feel
Yes.
good the
It's
body
basically helping the
opioids.
body prepare for exercise
Yeah.
and allowing them to tolerate more than they would have if you just jumped right into it. That's a really good point because a lot of people will say, oh, they're just throwing people on the bike. But
Yeah.
there's really a scientific reason behind it.
Yeah.
And just getting your blood flowing, getting oxygen to the area, getting oxygen to the nerves also is a way to kind of reduce pain in that area.
Yeah.
So there's science behind it. And even
Yes.
icing. So icing actually does
Okay,
help a
I
lot
had a
too.
question about that actually,
Yeah.
because I get this question a lot and I have conflicting thoughts. So
Okay.
you
Wait,
are
what
you saying
question?
ice over heat?
It depends, right?
Yes.
They were saying that ice can help calm the very sensitive nerves. That's what they were saying here. But
And not heat though?
No, because because he increases excitation. So it's going to send those
Yes.
signals more. They said in the research it was better, cold was better, but sometimes, well, actually, no, that's interesting because before they said it can increase it, right? But
Yeah,
here they
I
said
usually
ice.
yeah,
Yeah. I was going to say though, what I usually say is I use ice for if you want vasoconstriction. So that means like
yes,
constriction of the blood vessels. So
yes,
that's going to reduce inflammation in the area. In an acute, like if you have an acute injury though, inflammation is not a bad thing. It's your immune system sending
yeah,
important things to the area. I say whatever floats your boat. If
yeah,
cold
that's
feels
fair.
good, then let's
Mhm,
do cold. If you want to reduce pain, let's do cold. If
yeah,
heat feels good, if it calms your body, if it
yeah,
reduces your stress, if it relaxes your muscles, then let's do heat. It's really
mhm.
just what the patient wants to get out of it,
Yeah,
is what
that's
I'll
fair.
explain to
Yeah,
them.
or whatever you feel is best. I usually
Mhm.
say heat though. I say ice for very specific things. If I'm noticing someone is more of that like type A, super wound up, high stress, this area is super just like
Mhm.
aggravating them, I usually say heat.
Yes, to
Yeah.
relax them a little bit. Yeah.
Yes.
So
Yes.
actually at our current clinic, we have this really nice thing. It's a vasopneumatic device.
Yes, we have that
So
too.
is it the Game Ready? Or would
Yes,
you
I
use
think
a different one?
so. You do use
Okay.
it for like knee, shoulder, ankle,
Yeah.
whatever.
Yeah.
Yes, yes.
Not like hip because it's a yeah.
No, yeah, too
So
big.
people love it.
They
People
do.
rave about it. And
Yeah, because
so
the compression.
yes, the compression, and I'll say massage and instantly they're like, "Okay, I love that." It does compression, not as much
Yeah,
massage, but it can feel like a massage,
yeah, that's
and
fair.
that kinda helps them to buy in.
Yeah,
But yeah, it just depends on what you're really trying to get out of it. So if you
yeah,
have an injured body part and it's been in pain usually for a long time, more in that like subacute chronic phase, then yeah, use some cold. Usually doctors recommend because we talked about rice too.
yeah.
Remember? And we were saying how like they don't necessarily say that you need ice anymore.
Mhm.
So, like I said,
That's
there's
interesting you
conflict.
said that though, actually,
Yes.
because I am also being those conflicting people because I say for the subacute chronic phase, I usually say like limit ice. I usually say heat over ice.
Yeah, I mean, it depends.
For the
Like I said,
yeah, yeah,
evidence is very conflicting. Even in this
yes,
book, I'm realizing that they said cold can predispose you to hyperalgesia and like very
yeah,
sensitive pain. And now they're saying
yeah, yeah, yeah.
use ice. So,
Right.
like I said,
The
evidence is
reasoning
very
is the
limited.
biggest thing.
Or not limited, it's very conflicting.
Yes,
So,
yes.
that's why I always say you always ask the patient first. What do
Yeah.
you use at home? What do you prefer? And if they tell me they like hot showers, if they tell me,
Right. Then
they
heat
gravitate
clearly.
towards the
Yeah.
heat, we're gonna
Huh.
do heat. But
Right.
honestly, the data is so conflicting and it really just depends on what you're looking for with
Honestly,
that
yes. I
the
think it just goes back to understanding what that person is like actually feeling.
looking for. Yeah.
Yeah, like looking
Yeah.
for, feeling what the actual goal and reasoning is, which I think a lot of people lose sight on and just assume like,
Mhm.
oh, everyone needs to be doing ice or something. But like it
Mhm.
really goes back to the actual reasoning and what you're trying to achieve. And that goes back to knowing your body and understanding what your body needs and wants and like that mind body connection, which a lot of times for chronic pain is just not there. And mind body
Mhm.
connection and neuroscience are directly related, pain neuroscience.
There's a lot of people that have been in chronic pain that I have recommended, like psychotherapy or seeing a counselor or someone, because it's not just, like we
Yeah.
said, so much. I mean, all of pain comes from the brain, right? It's perceived by the body, the
Mhm.
input, but the brain is the one that says, oh, that hurts. And so I think that a lot of people actually could benefit from like actual like psychotherapy. And we could work
Fair.
very closely with those therapists as well.
Yeah, I
So
would love to have, like, a psychotherapist or psychologist on the pod.
that works with patients that are in
Yes.
chronic pain.
Oh my
Yeah.
gosh. Yeah, that'd be
Yeah, that
so
would be
cool.
really interesting. Like fibromyalgia is a big one because people have like
Yeah,
flare-ups with that. Things can be really uncomfortable or
right.
sensitive.
Yeah,
So,
and that's a whole other discussion, the
yeah.
fibromyalgia and chronic
Yeah.
pain and complex regional pain syndrome.
Yes.
Whole other
So,
bucket.
that kind of wraps things up,
Yeah.
right?
Yeah,
Yeah.
and also, this is a great, great tip that I forgot about and Something
Mm-hmm.
we just don't think about is that visualization. Visualize yourself doing those movements that
Oh,
you might
yes.
be scared of or make you nervous. Imagine that body part, right, is at 100% where you want it to be, even though you're not there yet. Imagine that and give your brain that like extra little push to that direction to get those happy thoughts and mindset shifting. So
The
visualization.
brain is a
Yeah.
very powerful thing, and use it to your advantage, right?
Mhm.
You do not want
Yes.
it to tear you down, because if you convince yourself of something, you best believe your brain is gonna believe it too.
Right.
So
Yeah.
if you tell yourself you can't do it, you won't be able to do it. If you tell yourself that you can start a podcast and you can make it successful, then you're gonna be able to do it.
Yeah.
So honestly, that's a big thing, is just rewiring your brain.
Totally. Fake it till you
Yeah.
make it, and then it becomes a reality. Yeah.
Exactly, I love it. That should be the slogan of the podcast,
I need to write it down.
and for the entire healthcare industry.
Till
Just
you make
kidding,
it
just
and make
kidding.
it a reality.
Yeah.
All right,
Well,
guys. Well,
on
I
that
think,
note,
yes, I think that's a good ender. That was like a mic
perfect.
drop right there. All right. Well, we hope you guys enjoyed today's episode talking about pain neuroscience and giving you some research and personal experiences and all of the things that really is just an important topic in the healthcare industry and something that we need to talk about more because chronic pain is real. Pain is real, but we can always do things to help it. Don't forget to follow, rate, subscribe to our podcast so that we can keep growing and get cool guests on like a psychotherapist and psychologist and more people. And if you have any ideas for us that like you want us to talk about, topics you want us to talk about, or like a certain profession you want us to have on the podcast, please let us know. Put it
Yeah,
in the
or a
Google
specific
form.
person.
Yeah, put it in the Google form or message us, literally whatever, wherever you want to reach us. You can just message us. Tune in every Tuesday for a new episode and topic. And if you are interested in travel, jobs, PT, OT, PTA, all of the specialties, we've just been getting so many messages about it. So please go into that Google form we have for you. It'll be in the episode notes, and you could also find it on our like Instagram page. But if you're interested and want us to connect you, we have so many recruiters we can connect you with, internal, external, bunch of specialties, not just physical therapy. So don't forget about that. And yeah, we'll see you guys next week.
Bye.
Bye.